Today we are going to discuss a very important topic in pharmacology, that is known as effect of drugs on dog's BP and heart rate. So in this lecture we are going to see the various effect of drugs on the dog's BP and heart rate. This experiment is fully nowadays we are doing in the simulated environments or the model, because the experiment on the large animals are now prohibited for the academic purposes by the committee that is known as the CCSCA. The full form of CCSCA, Committee for the Control and Supervision of Experimental Animals. Nowadays we are allowed to do the experiment for the academic purposes only in the small animals like the rodents. For the experiment on the large animals like cat, dogs, monkeys, we have to take the special permission from the CCSCA, that is not allowed in the academics. So let's start the lecture. What are the aims for this experiment? Here we are going to discuss some phenomena. First, we are going to demonstrate the various effects of the drug on dog's BP and heart rate. Various effects of drugs. We are going to see the interaction between various drugs. Interaction between various drug, or we can say the effect of drug after drug. A very important phenomena in the pharmacology that is known as the vasomotor reversal of Dale. We are going to discuss vasomotor reversal of Dale. This phenomena is also known as the Dale's phenomena. Fourth, we are going to discuss the potentiation or the potential action of the drug. How the one drug increase or decrease the action of the other drug. What is tachyphylaxis? We are going to see the effect of drug that is causing that phenomena is called as the tachyphylaxis. Sixth, what will be the effect after high dose of acetylcholine? What will be the effect of high dose of acetylcholine after atropinization? So here we are going to see the effect after the carotid occlusion. What will happen when we will do the carotid occlusion in the dog? After the electrical stimulation of the central vagus nerve, electrical stimulation of the peripheral vagus nerve, the effect of the epinephrine or non-adrenaline, isoprenaline, acetylcholine, histamine, ephedrine, phentolamine, propranolol, atropine, cimetidine, like that. So what will happen when we will do the carotid occlusion in the dog? So let's see. Suppose if we occlude the carotid artery, what will happen? There will be activation of the baroreceptors that are present in the carotid sinuses, and the stretching of these baroreceptor will decrease because the signals comes to the baroreceptor, and it uh, tells the baroreceptors that the amount of the blood or the amount of volume of the blood is less in the body. So this baroreceptors gives a response to the brain stem, to the medulla oblongata, and the reflex action will generate that will cause the increase in BP and the heart rate. So BP and heart rate after the occlusion of the carotid artery in the dog. Here we can see black graph of the BP, that is increases, and the red graph for the heart rate, that is also increases due to the occlusion of the carotid artery. Now what will happen after the electrical stimulation of the central vagal nerve? We all know mainly vagal nerve is the parasympathetic nerve, and the sensory neurons of the vagal nerve is present in the brain stem, like the nucleus tractus solitarius afferent fiber are affected. So these stimulation will activate the parasympathetic system in the body, and this parasympathetic system activation will cause stimulation of the M2 receptors that are present in the SA node that is responsible for the automaticity of the heart. Due to the depressive action on this receptor, the heart rate will decrease, and we know the general concept that is the cardiac output is equal to heart rate into stroke volume. So the heart rate is directly proportional to the cardiac output. If the heart rate is decreased, that will lead to the decrease in the cardiac output, and ultimately BP is also decreased. So because of the stimulation of the central vagal nerve, the final action on the BP and the heart rate is BP decreased and the heart rate is also decreased. Here in the graph we can see decrease in the BP and the decrease in heart rate also. What will happen when we stimulate the peripheral vagal nerve? Peripheral vagal nerve stimulation means we are going to stimulate the fibers that are coming from the vagus nerve, the efferent fibers that are going to directly act on the M2 receptors that are present on the heart, and the phenomena will be same. M2 receptor will cause the depressive action on the SA node, and that will lead to decrease in the heart rate, and because the cardiac output is equal to directly proportional to the heart rate, so the cardiac output will decrease and the BP is also going to decrease. This decrease is more sharper than the central vagal stimulation. Why? Because the efferent fibers are directly act on the M2 receptors, and the effect is direct on the heart rate and BP. So the sharply decrease in the BP and the heart rate graph. What will be the effect after giving the adrenal? This is very important because we all know adrenaline is adrenergic drug, and this drug is act on the all adrenergic receptors like alpha 1, alpha 2, beta 1, beta 2, beta 3. Here we are not going to discuss about the beta 3 action because we have to mainly see the effect on the heart rate and BP that is mainly affected by the alpha and the beta 1 beta 2 receptors. So we all know that the alpha 1 are the strongest receptors, strong receptors, and beta 2 is sensitive. And another thing we know that all the adrenergic receptors are G coupled protein receptors. So alpha 1 is G coupled protein receptors and it is activated by the GQ protein, alpha 2 activated by the GIGO, beta 1 activated by all the beta receptors are activated by GS subunit. So if the GQ activated means there will be the activation of the IP3 DAG pathway that will ultimately lead to the release of the calcium in the body. Remember one thing, anywhere calcium is released that will cause the contraction. But if the calcium is released most of the smooth cell, that will cause the vasodilation because of the activation of the kinases enzyme like ANG, and the increase of the level of or the release of the nitric oxide in the endothelium. That will lead to the dilation of the vessels or the smooth muscles. So, if alpha 1 activated, mainly the alpha 1 receptors are present in the vessels, and this is a strong receptor. So, that will lead to the vasoconstriction. If the vasoconstriction occurs, the BP will increase. Due to the activation of the beta 1, the heart rate will increase. Due to the activation of the beta 2, that will lead to the vasodilation. The main effect of the adrenaline is demonstrated on the alpha 1 and the beta 2 receptors, because when we give the adrenaline to the dog, what will happen? First, adrenaline will cause the activation of the alpha 1 receptors. So, alpha 1 activated, BP increased, but after some times the drug is going to metabolized in the body. Because of the metabolization, the amount of drug is going to decrease in the body. BP is coming down, but BP is not stop here. Why? Because the when the amount of the drug is decreases or less in the body, that is not able to activate the alpha 1 or alpha 2 receptors. Because of the beta 2 are the more sensitive receptor, it will cause the activation of the beta 2 receptors, and the activation of beta 2 receptor lead to the vasodilation. So the BP is coming down and it is decreases, and when the drug is fully eliminated, the BP comes to the normal. So we will see a biphasic wave, and this biphasic wave is specific for the adrenaline administration. Biphasic wave. Another thing, why this is clinically, what is the clinical importance of this? Suppose if we give the alpha blockers, if suppose if the dog is on the alpha blocker, if we previously give alpha blocker, alpha 1 alpha 2 beta 1 beta 2, if the dog is on the alpha blocker, what will happen? Alpha is blocked, both alpha are blocked. So when at this time when we give the adrenaline, alpha is blocked, there will be no increase in the BB, there will be no vasoconstriction. So all the amount of drug is directly going to act on the beta 2 receptors, because beta 2 is more sensitive, and the main effect we will see the beta 2 receptor even more than beta 1 receptors. So the BP is suddenly drop in this dog, and this phenomena is known as the vasomotor reversal of Dale. This phenomena is known as the vasomotor reversal of Dale, because here the all adrenaline is act on the only beta 2 receptor because of the blockage of the alpha receptors by any alpha blocker drug. Let's discuss the next drug, non-adrenaline. Here we know, here we can see in the graph also the biphasic response of the adrenaline, and remember one thing, if the BP is decreased due to the peripheral vascular resistance, there will be a reflex response generated from the vagus nerve and the heart rate will be opposite. Here BP is increased due to the alpha 1 action. So sudden BP increased and the peripheral vascular resistance will increase, that will lead to again activation of the vagal nerve and that will lead to the decrease in the heart rate. Let's discuss the norepinephrine, noradrenaline. This drug is mainly act on alpha 1 receptors, alpha 2 receptors and beta 1 receptors. This drug is not acting on the beta 2 receptors. So if the drug acting on the alpha 1 receptors and alpha 2 receptors, what will happen? Because of the strongness of the alpha 1 receptor, we will see only the effect of the alpha 1. Because of the beta 1 heart rate increase and the cardiac output, that will again lead to increase in the BP. So there is a strong elevation in the BP, and due to the BP is elevated, increase the peripheral vascular resistance, that will lead to again the activation of the reflex phenomena from the vagus nerve, that will lead to the decrease in the heart rate. So here in the graph we can see decrease in the heart rate and increased in the BP. What will happen with the isoprenaline? If we give the isoprenaline to the dog and we know that the isoprenaline is only acting on the beta receptors, non-selective beta agonist. So remember here one thing, beta 2 receptors are responsible for vasodilation if they are activated, and beta is responsible for increase in the heart rate. So if we give the isoprenaline, what will happen? Due to the beta 1 receptors, heart rate will increase. If the heart rate will increase, the cardiac output will increase and the BP will increase. So most probably there the result will be the increase in the BP, but this will cause the increase in the systolic BP. Now, the major action comes from the beta 2 that will lead to the vasodilation. Vasodilation. If the beta 2 activated and the major action coming from the beta 2, so it will lead to the decrease and more decrease in the diastolic BP. If the diastolic BP more decrease, then the mean arterial pressure will be decreased, not increased. So after giving the isoprenaline, the BP in the dog is decreased, and the because BP is decreased due to the beta 2 receptors that are present on the vessel, that will lead to the decreased peripheral vascular resistance, that will lead to increase the or a reflex phenomena is generated, that will lead to increase in the heart rate. So here in the graph we can see decrease in the BP and increased in the heart rate. Acetylcholine, very common drug of the parasympathetic system. This drug is act on the muscarinic receptors and the nicotinic receptors. Remember M4, M5. There are 5 types of muscarinic receptors and nicotinic receptors, but the action on the nicotinic receptors normally in the low dose is very less, very less. So main effect we are going to see on the muscarinic receptors, and in the muscarinic receptors M2 is the present on the SA node, that is mainly responsible for the automaticity or the heart rate, and this is the strongest receptor. that is depressed by the acetylcholine, so the heart rate is decreased. M3 receptors are present in the smooth muscles of the vessels. Generally, what will happen when the stimulation of the M3 receptors, that will lead to again increase the concentration of the kinase G, or the increase in the level of the nitric oxide, that will again cause the vasodilation, and this vasodilation will lead to more decrease in BP. So here we can see both BP and heart rate is decreased after administration of the acetylcholine in the dog. What will be the effect of histamine? And we know that the histamine act on the H1, H2, H3, H4 receptor. Here H3, H4 are not very important because mainly H1 and H2 are present on the vessels. The H1 are present smooth muscles of the vessels, and mainly H2 are present on the smooth muscles. So the activation of the H1 will lead to the, or both receptors are G coupled protein receptors. H1 are mainly activated by the GQ subunit, H2 are mainly activated by the GS subunit. Both will lead to the calcium ion release, but what will happen because of the increased level of the nitric oxide in the endothelium will lead to smooth muscles relaxation, and because of the increased level of the kinase G will lead to the decrease in the, or smooth muscles relaxation. Both will cause decrease in the BP. H1 will cause more sharply decrease in BP. H2 in comparison to the H1 will cause a less sharp decrease in BP, but both substance are causing decrease in BP, that will lead to the decrease in BP. And here we can see both receptors are present in vessels, so it will affect the peripheral vascular resistance, that will decrease, and there is activation of the vagus nerve, that will lead to reflexly increase the heart rate. Let's come to the ephedrine. Ephedrine is the drug that acts through the non-adrenaline releasing that are present in the presynaptic neurons. The level of the non-adrenaline is released through the ephedrine. So if the non-adrenaline is released, and we know the non-adrenaline will cause the increase in BP due to the activation of the alpha 1 receptor, because this act on the alpha 1, alpha 2 and beta 1. So here a question, if the BP is increased, why the heart rate is not reflexly decreased? Because this drug is secreted from the presynaptic neuron. So this release is slow. Because of the slow release of the non-adrenaline, BP is increases slowly, and the effect of, and the vagal reflex will not occurs here. So the BP is increases, and the heart rate is also increases here. An important thing with this drug, tachyphylaxis phenomena. Remember one thing is the down regulation. What is the down regulation? That are mainly seen with the G coupled protein receptors. Down regulation is the decrease the number or the sensitivity of the receptors after giving again and again drug. What will happen here? Here the phenomena of tachyphylaxis is seen. What is tachyphylaxis? If we give again the ephedrine to the dog, the amount that is already released in the blood dog, that will, the remaining amount will be less here. So if we give again the non-adrenaline, the drug that is released will be less than the first time. So when we give next dose, the BP will increase but less than the first dose. Again the amount will decrease more, the BP will increase less than the previous dose, and this is continuously happens, and this phenomena is known as the tachyphylaxis, because the drug that are secreted from the presynaptic neurons are continuously going slow. What will be the effect of the phentolamine? We all know that phentolamine is the non-selective alpha blocker. If we are giving alpha blocker, so what will happen? The main action of the alpha 1 is the vasoconstriction. If we block suddenly this receptor, what will happen? The BP will decrease due to the vasodilation, because alpha 1 is the strongest receptor. BP will decrease, and BP is decreases due to the receptor that is present on the vessels. If the receptor is present on the vessel, that will lead to the peripheral vascular resistance decreases, and that will generate a reflex phenomena from the vagus nerve on the heart rate, that will lead to increase in the heart rate. So here in the graph we can see decrease in the BP and increase in the heart rate. What will happen with the propanolol? So we all know that the propanolol is the non-selective beta blocker. If this drug will block the beta 1 and the beta 2, if the beta 1 is blocked, that is responsible for increasing the heart rate will decrease. If the beta 2 is blocked, remember one thing, beta 2 is responsible for the vasodilation. If the beta 2 is blocked, that will not lead to the increase in the BP. Remember this thing, when the beta 2 is blocked, that will lead to the stop in the decreasing of the blood pressure. The blood pressure will stop at the baseline. So that will not to decrease in BP. There will be no effect on the BP. So how the BP is decreases? Because of the decrease in the heart rate. If the heart rate is decreases, and we all know that this is directly proportional to the cardiac output, that will lead to the decrease in the BP. So the heart rate and the BP both are decreased after the administration of the beta blocker, non-selective beta blocker, because the heart rate is decreased directly by the activation of the beta receptor, not due to the reflex response. Atropine, there is some important thing with the atropine is the muscarinic blocker, mainly act on the M1, M2 and M3 receptor. So we know that the M2 receptor is present on the SA node, and the blocking of the M2 receptor will lead to the increase in the heart rate. So what will happen with the BP? We all know the M3 is responsible for the vasodilation, and normally this receptor cause the vasodilation in the body. If we give the atropine, that receptor will blocked. So this vasodilation is trying to come on the baseline. That's why sometimes we can see a slight drop in the BP. Heart rate is already high, but there is slight drop in the BP. Let's come to the cimetidine. Cimetidine, we all know that the cimetidine is responsible for the blocking of the H2 receptors. And we know that the H2 receptors are mainly responsible for the vasodilation, but blocking of these H2 receptor will lead to stop the vasodilation, and the BP will normalize and nothing happened with the heart rate, because there will be no effect on the peripheral vascular resistance. We already saw what is the reversal of Dale phenomena, because we discussed that the after administration of there is the biphasic wave, but if we give the alpha blocker, this biphasic wave is converted into the sharp drop in the BP. Why? Because alpha is blocked, there will be no effect of the alpha 1 receptor, only effect of the beta 2 receptors. So suppose this condition occurs in any patient. How this condition will occur in any patient? In the pheochromocytoma, this tumor of the adrenal gland is present, and sometimes this is adrenaline secreting tumors and sometimes non-adrenaline secreting tumors. If this is adrenaline secreting tumors, there is a continuous release of the, or after some time pulsatile release of the adrenaline in the body. We see that the BP is high in the patient and we want to decrease this BP. We give the alpha blocker in this patient. After giving the alpha blocker, what will happen? There will be sharp drop in the BP. So what is the solution of this problem? Because BP is dropped because of the activation of this beta 2 receptors, so we have to give here the beta blocker also. So the treatment will be alpha blocker plus beta blocker, and when we block the beta, what will happen? BP will come to the normal, and this phenomena is called as the reversal of Dale phenomena. Reversal of Dale phenomena was discovered by Henry Dale. What will happen after the high dose of the acetylcholine after atropinization? So let's discuss low dose acetylcholine. If we give the low dose acetylcholine, that is mainly act on the M2 receptor, we already saw, that will lead to the decrease heart rate, and because of the M3 receptor, that will lead to the decrease in the BP. But after this, if we give the atropine to the patient, what will happen? Atropine, after giving the atropine to the patient, that receptors are going to block, because atropine is act on the muscarinic receptor. Because of the blocking of these receptors, the effect of the M2 and the M3 will gone, and the BP is trying to normalize. Remember here all muscarinic receptors are blocked. Now if they are blocked, and because of the low dose of the acetylcholine, there are minimal action on the NM and NG receptors also. If after the blocking, if we give again the high dose of acetylcholine, what will happen? Because muscarinic is already blocked, if we giving the high dose of the acetylcholine, that will act directly on the NM receptor and NG receptors. This NG receptors was previously known as the NN receptor also, that are present in the autonomic ganglia, and from the adrenal gland they will release the catecholamines like the adrenaline, non-adrenaline, that will cause the sharp increase in the BP. So after giving the high dose acetylcholine after atropinization, that will lead to the sharp increase in the BP. Let's see the potential action of the neostigmine after acetylcholine. And we know acetylcholine is mainly causing the decrease in the BP and the heart rate through M2 and M3 receptors. What will happen after giving the neostigmine? What is neostigmine? That is acetylcholine esterase inhibitor. Acetylcholine esterase enzyme inhibitor. So this enzyme is mainly responsible for the acetylcholine. Because of the blocking of this enzyme acetylcholine esterase, the amount of the acetylcholine will increase in the body, and that will lead to the more decrease in BP. So this is known as the potentiation of action of neostigmine after acetylcholine. Acetylcholine already decreases the BP, and because neostigmine, that is acetylcholine esterase inhibitor, choline is more in the body, and the effect of the acetylcholine is also more in the body, so that will lead to the more decrease in the BP, and this is the potential action of neostigmine after acetylcholine. So I hope you all understand the various effect of the drug on dogs BP and heart rate.